I thought about this, what, 30, almost 30 years ago, right? And I thought about what was the scenario then? And am I just kind of hallucinating about how exponentially in the past 30 years, the degree and the level of both, different ranges of allergy and even asthma now has really accelerated? Welcome to the show, Tanya. It's great to have you here. What do you think about what I just said?
Certainly, we agree. I mean, if you look at all the statistics, the prevalence of allergy and asthma is on the rise and has been so for quite some time. Now, what we have seen over the last several decades is a leveling off of the deaths due to asthma, which is, I think, because we have much better treatment as well as this heightened awareness. And that's really what I was hoping we could spend most of our time today talking about,
Yes.
how we do raise that level of awareness
Yes.
about these conditions as well as about the network.
Yes. And that is really what this show today is about. Because while things may have changed, in the past 30 years, they're changing because action is being taken. And action's being taken exactly like you talk about. Today we're talking about what the commitment is of the Allergy and Asthma Network, to engage patients and healthcare professionals in a variety of ways. It does take a village, doesn't it?
Yes, yeah, it certainly does. And that's exactly what our outreach efforts are cornerstoned upon. We have a network of over 800 outreach service coordinators throughout the country. Those are asthma educators as well as board-certified allergists and parents and school nurses who go into their local community and help to raise the awareness of these disease states and the impact.
And, I know that this is something that is an ongoing conversation about who we are and how we're out there in the world. Um, but, it's really interesting that we really don't know what all is involved. I would love for you to talk about what kinds of things are out there, what kinds of outreach, what kinds of opportunities are there now for people to learn more?
Well, I think, certainly with the introduction of the World Wide Web over the last couple of decades, that is our face and our presence to the world. So we actually have about 25, 30,000 unique visitors coming to our site each and every month and engaging with the network virtually in that way. But when we think about face-to-face, boots on the ground, it is through that outreach service coordinator network, and they are actually going to health fairs and to Girl Scout and Boy Scout meetings and conducting asthma and allergy screenings across the country and, doing a lot of media campaigns and things like that just to really help the general public be aware that these conditions exist and that they continue to have an extraordinary burden on our American society.
Mm. One of the things I love to talk about is what is the experience. I want to ask you to share a little bit about this. I mean, you travel the country. I mean, you're traveling now, and you get to be up close and personal with people. People that are in the professional world. You get to be up close and personal with patients. I want to ask you, what are you hearing people say, Tanya? What is on people's minds right now?
Yeah, when it comes to allergy and asthma, I think it is a very interesting dialogue, and because again, patients are people. They're people like you and me, Dr. Pat. They have a lot of different roles that they play, whether it be wife, sister, mother, friend, daughter, employee, community activist, whatever those roles are that we all hold, and yet the one of patient is one that in many ways we want to acknowledge and yet also move beyond and move on to the rest of our lives. And so how do we do that, especially when you're talking about something like allergy and asthma, when it can have such a significant impact on a person's quality of life? And so, people think, oh, it's just allergies. It's only a couple of months out of the year. Well, in fact, the quality of life studies would say that those 2 months of the year is quite impactful. They're not sleeping. They're not as productive at work. They're constantly living in the fog of some of the antihistamine medications that are on the market in the pharmacy aisle. And, people just don't realize how it can significantly impact their existence.
Mm-hmm.
And then when we talk to families with asthma, it's much more about, that they were quite honestly unaware that someone could potentially die from asthma, that also someone should, if they're well controlled, not have any limitation to things like exercise or housework or outdoors activities. And so just that lack of understanding about what true control of these conditions means and how one can live a life without limits, even in light of those diagnoses.